Is sponsored by
Delta Dental of North Carolina continues to grow as one of the largest providers in the state and across the country, not only ensuring we find the perfect fit for our healthcare needs, but also providing a wealth of information to help prevent and manage any problems along the way. Here with us today, we welcome Dr. Zachary Brian, and we're talking about a very serious disease, oral cancer. Doctor, thank you so much for joining us.
Thank you so much for having me.
Well, April is Oral Cancer Awareness Month, and we were talking, this is a cancer that a lot of people, it's very prevalent, but we're not often checking and seeing if we have this.
Absolutely, Amber. So oral cancer and oropharyngeal cancer is very prevalent. We have about 58,000 cases that are diagnosed. It will be diagnosed in 2024, which is affecting, quite a few Americans. But what's really important to note is that prognosis or outcomes is really poor. So diagnosis is often too late, and so we have a person die every hour in this country.
Wow.
Yes.
I mean, and that's so true because we hear about a lot of the other cancers and health issues. I don't know how often, even in the news world, that I hear about oral cancer being something that we need to think about and check in on, which we can do ourselves at home.
Absolutely. So just like you would do a breast exam at home or a testicular cancer exam at home, you really should be doing an oral cancer screening at home as well.
Well, you brought this handy dandy mirror for us today, and you're going to lead us through one. I'm going to actually do this. We're hoping we don't find anything, but it's very important that we show people and show our viewers that this is something we should be doing, you said weekly, monthly, and keeping tabs on, and then going and seeing our healthcare providers if we find something.
Absolutely. So it's important to note that even though that diagnosis is prevalent for oral and oropharyngeal cancer, if it's treated early or caught early, it's very treatable. And so when you're doing your self-exam at home, I'll walk you through kind of what you're looking for.
Everybody's going to see my mouth very up close and personal.
Okay. So it's really easy. So you just need a mirror. You can use your bathroom mirror is fine. You need some light source. So if you have a flashlight, that works great. But you can also use, the flashlight on your phone, for example. So I'm going to walk you through the high-risk areas inside the mouth that you want to be looking for. So if you can go ahead and put the mirror up. So what you're looking for are any lumps or bumps inside the mouth that weren't there before. You're also looking for any red areas or white areas or a mix of those two colors. And what the important piece here is to remember is that you're looking for certain areas within the mouth. So if you can go ahead and stick your tongue out.
Okay.
And then move your tongue to the left and right. Go ahead and open a little bit wider if you can. Perfect. You can take your fingers, make sure you wash your hands first, of course. But you can take your finger and go ahead and just move your tongue to one side.
Okay.
Perfect. So what you're looking for there is, again, any lumps or bumps, red areas, white areas, or a mix of those two colors that was not there before. Go ahead and stick your tongue all the way out if you can. Perfect. Now pull your cheek to the side. You're going to look on the inside of the cheek as well. And you're going to look underneath the tongue. That's a high-risk area as well. So put the tongue to the roof of your mouth. Open a little bit.
I'm failing the exam.
That's okay.
I'll move the mirror so everybody at home can see too and kind of check.
Excellent. So yes, absolutely. Then go take your finger, as I mentioned. Be gentle, of course. This is a sensitive area, but go underneath the tongue.
Okay.
Take your finger and just press underneath the tongue. Excellent. Absolutely. You can see there. So what you're looking for, again, any lumps, bumps. Were they there before? If not, what you need to know is if they don't resolve on their own in 2 weeks, you need to seek, an examination from an oral health professional.
And you should be doing this every week. I mean, it's an easy exam. I'm struggling at it because I'm seeing myself in there and I'm looking in the mirror and all different things. So basically just remember, open your mouth, check all the inside.
Correct.
Move your tongue back and forth.
Correct.
And then lift your tongue up.
Absolutely. So the tongue is a really high-risk area for oral cancer. Now, oropharyngeal cancer is basically everything that you can't see, right? So think throat. So you're not going to be able to check there. But what you're looking for are any symptoms like hoarseness, change in the voice, difficulty swallowing. Those are symptoms that you should not ignore.
Okay, good to know, and very, very important that we do this. What are some of the causes of these cancers?
Yeah, so a lot of it's behavioral risk. So smoking, using smokeless tobacco products, drinking alcohol excessively. It is really important to note, and this is something most people don't know, when you concurrently use, meaning at the same time, you smoke a tobacco product or use a tobacco product and drink, it increases your risk of oral cancer by 5 times.
Wow.
So when you're doing them together, yes, absolutely. The other thing I want to mention is there's a viral cause which has become really the predominant player, particularly with oropharyngeal cancer. It makes up 70% of all oropharyngeal cancers is due to human papillomavirus or HPV. And, you know, I know that that's not something also we talk a lot about, but it's important to note that 90% of all sexually active men and 80% of all sexually active women will have HPV in their lifetime.
That's why it's so important that people like you and doctors like you come in and talk about us and that we start doing these exams. Doctor, where can we go for more information?
Absolutely. So there is the Oral Cancer Foundation has great information, the CDC as well. Mayo Clinic also has great information. That's a wealth of knowledge there for you.
We appreciate you coming in today. I'm going to work more on this exam and I'm going to start adding this to my healthcare routine because I think it's really important, and I think it's important that all of us do this. Thank you. Thank you so much for being here today.
Thank you for having me.
The preceding was sponsored by